Okay, so for my 5-minute video, I'll be covering intussusception. Intussusception occurs when there is a telescoping of one segment of the intestine into another. This can occur anywhere along the small or large bowel and extend any distance. When this happens, there is an obstruction preventing the passage of food or digestion. The most common cause of intestinal obstruction occurs in children 3 months to 5 years old, and while it can happen in adults, it is much more rare. An abdominal ultrasound is the gold standard of diagnosing, as it is the most accurate. Common risk factors include male sex, ages 3 months to 5 years, an abnormal formation at birth, a recent upper respiratory virus or GI infection, appendicitis, a medical condition, foreign body, abnormal tissue mass, and in extremely rare cases, a recent rotavirus vaccination. In adults, it can be caused by a polyp or tumor, adhesions from scar tissue, weight loss or intestinal surgery, or inflammation from disease such as Crohn's. However, it is common to have difficulty finding the root cause in adults. Some key questions to include are, have you noticed a change in stool? This is important because a telltale sign of intussusception is current jelly-looking stool. Has there been a recent change in appetite? Especially in children, they often have a decrease in appetite and show signs that they're experiencing an upset stomach. And does the patient have a recent history of upper respiratory infection or any type of chronic disease? This would make the patient more prone to intussusception if there are other symptoms aligning with this differential diagnosis. For a physical exam, the classic trifecta of symptoms that would lead to additional testing for intussusception is abdominal pain, vomiting, and bloody stools resembling currant jelly. The child may exhibit symptoms such as screaming, drawing up the knees, vomiting, and diarrhea. They also may have decreased appetite leading up to the cramping pain, be irritable, and appear to have a mass in their right upper quadrant. Bloody bowel movements and mucus may appear within the first 12 hours. Between bouts of crying and discomfort, children may appear febrile and lethargic. Once a differential of intussusception is decided upon, other diagnostics to consider would include testing for occult blood, which is often positive, an abdominal ultrasound, which is the gold standard of testing, fluoroscopy, or an abdominal x-ray, which is less sensitive. One treatment option for intussusception is a barium enema. However, this option should not be considered if there are signs of perforation, toxicity, or a strangulated bowel. If it's appropriate, an air enema can be used and has a success rate of 75%. This is the most therapeutic approach if it's utilized within the first 24 hours. The potential for recurrence within 24 to 48 hours is less than 5%. Surgery is also an option for very ill patients, those with concern for bowel perforation, or if an enema has been unsuccessful. And the potential for recurrence is even lower with this choice of treatment. Doctors may consider an NG tube until bowel function returns. Some potential complications can be fatal without emergent response and treatment due to bowel ischemia, perforation, or sepsis, and rehydration is very important with this diagnosis. Some patient education is because the risk of shock from infection is increased with this diagnosis. Families should know symptoms of shock include cool and clammy skin, weak and rapid pulse, abnormal breathing patterns, anxiety, agitation, and listlessness. They should also know that this condition is a medical emergency and to call a doctor or get emergency medical help if symptoms are present that include that trifecta of symptoms, drowsiness, or repeated cramping belly pain. Some patients will remain in the hospital until they can eat and have normal bowel function. Some patients may also receive antibiotics to prevent infection. Patients and family members should be educated to seek help right away, and untreated intussusception can cause serious medical problems. After treatment, make sure patients know to call their healthcare provider if there are additional bouts of vomiting, diarrhea, or jelly-like stools, fever greater than 101, signs of infection at the surgical site, and cramping or additional abdominal pain. And these are my references. Thank you.